Right, first and foremost, folks, let's talk about what the enrollment deadlines are. So let's put that up. So when you're looking at the deadlines for Medicare and you're looking at the deadlines for the ACA marketplace enrollment, you're looking at the Medicare deadline that is December the 7th. So that is next week. You have less than a week if you want to change what's going on with your Medicare plan. When it comes to the ACA enrollment deadline, you can see on your screen here, the deadline is the 15th of December, and that's if you want your coverage to begin as of January 1st, 2023. All right, hey Steve, let's first talk about Medicare. And a lot of people are like, all right, well, I'm already enrolled in Medicare, so why do I need to be up with this whole enrollment period deadline?
Okay, so this is just a great time of year. Let's say you're already enrolled in Medicare and you have a Medicare policy that helps out with expenses. This is the time of year. Maybe you don't like something about your plan. Maybe the drug coverage is not what you thought it would be. Maybe your copays are more than you wanted. So, this is the time of year when you can jump out of one plan and hop into a new plan starting January 1st of next year. So it's just a wonderful time of year where you have opportunity to do that. Now, it's important to know that this is a time for people that are enrolled in Medicare Advantage plans. They can act now. And also, even people that's still covered under traditional Medicare, but maybe they have like a standalone drug plan, the standalone drug plans can also be changed right now. So you have until December 7th, which I'm thinking is like next Wednesday.
Yep.
So you need to really get to work on that if you've not done it yet. So.
Okay. All right. So, Laura, let's talk about the ACA healthcare marketplace. The deadline is a little bit farther out, but we still want people to be looking at things. A lot of people will kind of go online and they'll be like, you know what, healthcare is too complicated. I'm just going to leave it in the same plan that I had last year. What would you say to that?
Well, first of all, there's two deadlines. December 15th, if you want coverage starting beginning next year. The absolute last deadline is January 15th for the procrastinators that wait through the holidays, and then your coverage would start in February. But why you should go back, even if you're already enrolled, is first of all, your plan may have changed, or it may have gone away, and you may be auto-enrolled into a new plan, and that may not be the best plan for you. And second, your life circumstances may have changed. And also, with everything that's going on in Washington with the Inflation Reduction Act, plans are cheaper than ever for next year in that there are more subsidies for people. So you may not have qualified in the past, but it's definitely worth going back to healthcare.gov, plugging in your estimated income for next year, looking through all your options, and picking the best one for your circumstances.
All right, and here's the beauty of all of this. You can go there on the marketplace and you can look at all the plans, but if you're still having trouble, there are helps out there for you. AARP can help out, but you can also call a insurance agent and they will walk you through things, and they don't get paid for that, not by you. There's no fee for you. It is free for you to do that. All right, Pat, let's talk about Medicare enrollment. Now, this is open enrollment right now, but there are some folks who are going to be getting to that Medicare age, and they're kind of unsure about when they need to sign up for Medicare. So what's the timeline for that?
Well, that's right, Tanya. Folks turn 65 every day of the year, and so they're looking at the trying to understand what the enrollment process is. Keep in mind that the primary federal agency for enrolling folks in Medicare is the Social Security Administration. And so folks they can go to the Social Security Administration .gov and enroll themselves if they're comfortable doing that, or they can contact their local Social Security office in their county and make arrangements. They can have their questions answered about the enrollment process, or they can actually set an appointment to enroll. Now, Social Security, there is something called automatic enrollment. Folks that are receiving Social Security benefits, for example, their retirement benefits early, they actually get enrolled automatically by the Social Security Administration. They'll actually get their Medicare card in the mail 3 months before they turn 65. But those folks, and there are a lot of them, probably the majority of the folks that are turning 65, they have what's called an initial enrollment period, which is it starts with their month of birth, and it's 3 months before So the enrollment process would begin 3 months before your month of birth and then 3 months after. So it's a 7-month window altogether. And they would go through that process again using Social Security online or the local Social Security office. Now, if folks miss that initial enrollment period, there's something called the general enrollment period. It comes around every year, which is January 1 through March 1st through March 31st. So there's that window is there for folks that fail to enroll when they could have during that initial 7-month period.
All right, so it is 7 months, 3 months before your birthday, your birth month, and then 3 months afterwards. Now, a lot of folks will say, well, I already have my employer's benefits, I'm still working, I don't need to sign up for Medicare when I'm 65 because I'm still working. What do you say to that, Steve?
Well, you probably need to still go ahead and sign up for your Medicare. Medicare Part A is free, so there's no cost for that. So it's always a good idea to go ahead and tag the Part A and go ahead and get it going. Now, if you do have employee benefits or group coverage through your employer, then obviously you can stay on that coverage and defer to Part B, which is usually the part that's going to cost you money, or they're going to withhold out of your Social Security check. So you can defer Part B, but go ahead and turn Part A on because it's free anyway, and that way you're in the system. And always remember, if you're doing that, if you're still working, once you do decide to retire and then you drop your group health coverage, you want to call Social Security again and get that Part B going right away because it's a short window there to get that going without having a penalty involved.
Yeah, that penalty for Part B is not something that you want because it happens for the rest of your life and you don't want to pay the extra cash. All right, we are back with our experts answering your questions. All right, Steve, let's talk about this. I'm retired and I have a company pension plan with PPO medical insurance. Should I be looking at these Medicare plans?
Possibly. So here's the deal with this question. If you have a PPO plan through your work, here's the questions you should be asking. What is my deductibles? What is my copays? And what is my annual out-of-pocket maximum? Okay, you can compare that to our Medicare Advantage plans or a traditional Medicare plan, and you can say, okay, what are those deductibles? What are those out-of-pocket maximums? So you have to compare those. So the answer to the question could be yes or no, depending upon your exact PPO plan that you have and what your deductibles and annual out-of-pocket maximums are. Most of the Medicare Advantage plans nowadays, you can get an annual out-of-pocket maximum a lot of times for $3,400, $3,500, $3,600. So a lot of times you're going to be in a better situation to go on Medicare and choose a Medicare Advantage plan.
All right, but that takes some doing, and so folks might need to call either SHIP or AARP or an insurance agent to kind of see if they can figure that out, but that's a good starting point. All right, Laura, this person's asking, is ACA better than North Carolina Medicaid for disabled folks?
Well, first of all, it's very hard to qualify for Medicaid in North Carolina because North Carolina is one of the 11 states that hasn't expanded Medicaid yet to low-income people. They nearly did it in the legislature this year, and they're looking to do it next year. So contact your legislators and tell them to expand Medicaid. But setting that aside, if you are eligible, it is probably a better deal for you because probably an ACA policy would cost more for somebody in your circumstances.
Okay, this person's asking about the deadline time of December 7th for the Medicare enrollment, and they're saying, is it true that the enrollment date has been extended due to the hurricanes?
I can take that. There are extenuating circumstances associated with certain special enrollment periods. One of them is a natural disaster, and that a hurricane would fit in that definition. So they have extended certain special elective circumstances. The best thing to do is to contact SHIP or 1-800-Medicare to find out if they would be eligible for that extenuating circumstance in that special enrollment period. But that is correct.
All right, it may be in some states or the people who were affected, but it's not
Right.
all for everyone.
Yeah, it's limited to a geographic area. That's correct.
Okay, good to know. All right, so Steve, this person is asking, why would I need to have a Medigap plan along with my regular Medicare coverage? Is that necessary?
Well, it's very necessary because when you're looking at your regular Medicare coverage, Part A is decent coverage. You do have a deductible if you go in the hospital, which is going to range you 1,500 bucks. But your problem is your Part B. It's like 80% coverage. So it's 80%. Guess who owes the other 20%? You do. So if you don't have a Medigap policy to fill in that 20% for you, then that 20% is going to come out of your pocket. So you really do need the extra coverage in most cases.
Okay. Laura, this person is asking, and I think it can go for Medicare or it can go for ACA. It says, if you like your coverage and you want to keep the same coverage, do you have to do anything?
You don't usually, because you will be auto renewed. However, you should definitely sign on, make sure that you still have the best possible coverage, and at least for the Affordable Care Act, update your income estimates for next year to see what other subsidies you qualify for.
Because they may have a plan that this year their doctor is on it, but next year their doctor is not on it. And it's not like there's going to be a big red flashing sign that says there's changes.
Absolutely.
Okay, so they need to check not just their doctors, but several other things as well. I'm thinking medications.
Your prescription drug coverage, what doctors and facilities are included in the plan, if any levels of what things they cover have changed as well. So it's always worth a few minutes to go back in and check and make sure.
Okay, yes, definitely check and see what those copays, those premiums, all that stuff is. Okay. Pat, this person says, if I've already signed up with an HMO plan back in September, but I want to change to another plan before the December 7th deadline, am I allowed to switch again?
Yes, she is. She has an HMO, which is a type of Medicare Advantage plan. And keep in mind that Medicare Advantage has its own unique open enrollment period, which runs every year, January 1st to March 31st. So folks that have Medicare Part C or Medicare Advantage plans can review their plans during the first 3 months of each calendar year and select plans that may be better for them. And that includes the plans that have, drug plans built into them. So yes, she'll be able to change that HMO if she
Great.
chooses to do so.
Great. This next question is, I'm recently back to North Carolina after living and working out of state. I'm unemployed and staying with family. Do I qualify for Medicare? Steve?
Well, you would qualify for Medicare if you're age 65. You could also qualify for Medicare if you are determined to be disabled by the Social Security Administration. And that would probably be the only couple of times that you would be able to qualify for Medicare. So other than that, you would probably need to hunt a regular health insurance plan.
All right, Laura, someone's asking about the premiums and if the premiums are going up again this year, or what do you say when it comes to, I'm not sure if I can afford ACA enrollment?
Well, if you haven't been able to afford it in the past because of the federal changes, you should absolutely go back to healthcare.gov and look again. And also, when you apply, you will estimate your income for next year. You may be eligible for additional subsidies. So check it out. Difficult to say without looking at their individual circumstances what they qualify for.
Okay. This next question is, I'm going to be 65 in June. My husband is younger than I am, and I'm covered under his medical insurance. Do I have to enroll in Medicare insurance? Pat?
That's a good question. And the answer is no, she doesn't have to enroll because she'll stay covered under the employer plan that her husband is covered with. And as long as that plan is credible coverage by definition that Medicare uses, and most employer health plans do satisfy that definition. So she would remain covered keep the coverage under the employer health plan, I would encourage her to enroll in Medicare Part A, get that part out of the way as soon as she can, because that's premium free for most folks anyway, but she'll keep her health coverage under the employer plan, as well as her drug coverage.
Right, and there's like a little caveat to that. You have to like check the box that says I'm deferring Part B. You don't want to leave it
That's
like
correct.
blank, because if you leave it blank, it means that you haven't signed up for anything, you haven't deferred, and then you get charged with the penalty. Hey, Steve, this question is for you. It says, will it cost me to work with an agent?
No. No, it
Explain
does
how
not.
that works,
Agent-
because I think some people think to themselves, the agent, of course, is going to charge me.
Okay, well, agents are sales agents. So basically, they're going to help people. They're going to give them quotes. They're going to give them recommendations. If you choose to go with that agent, the insurance company pays that agent, not the customer. And if you choose not to go with that agent, he just helped you for free out of the goodness of his heart. So there you go.
Okay, very quickly. Pat, if you have Medicare, can you also be eligible for Medicaid at 65? Can you have dual enrollment with both of those things?
That's correct. Depending on the state, your state of residence, that type of thing, and whether or not you're eligible. But there is a category referred to as dual eligible Medicare beneficiaries. And in that case, Medicare is primary and the state Medicaid plan would be secondary.
Gotcha. Okay. All right. All three of you, the deadlines are looming. We appreciate your time and your expertise. And if you have any other questions, all three of these folks have their resources that will be in the Two Wants to Know section, so you can click on those resources for them. Again, in the Two Wants to Know section.